We're doing chapter 11.2, Vision and Hearing. So the most common vision problem in middle childhood is myopia or nearsightedness. And in most developing countries, the incidence of myopia increases over middle childhood and into adulthood. As you can see from the picture, in normal vision, the light is focused directly on the retina, but then in nearsightedness, the light is focused in the front of the retina. Some genetic factors. So some scientists have done heritability estimates to show a moderate genetic influence on nearsightedness. They used twins and family members in the study, and it's also shown that children with low birth weight have myopia at a higher rate, and this is due to immature vision structures and slower eye growth when they're born.
Some environmental factors that affect myopic children are sitting too close to the TV or computer screen. And that's when you usually hear parents screaming like, "Oh, you'll ruin your eyes." This is also a common thing when children read or do homework in dim lighting, because you have a different kind of strain on your eyes instead of proper lighting. Next is more time children spend reading, writing, using the computer, and doing other close work is an increase of being myopic. But however, on the opposite side, more time children spend outside decreases the effects of myopia. So your future children should go outside. A study says that East Asian countries have an increased rate in children who spend time in after-school classes and doing homework. Therefore, they have higher rates in myopia. This is also increased in high SES families, which is opposite to what it would normally be, because of their access to computers, TV screens, and harder, rigorous academic programs that would include more homework time. Secondly, in the chapter, it talks about hearing problems, and this is due to the developing of the Eustachian tube. And the Eustachian tube is a canal that runs from the inner ear to the throat, and from infant to adulthood, it becomes longer, narrower, and more slanted. This prevents fluid and bacteria from traveling so easily from the mouth to the ear. And in infants, it is very common to get otitis media, which is a middle ear infection. And this condition decreases once the Eustachian tube develops. As you can see in the picture, the Eustachian tube is in the red circle, and then there's a picture showing the difference between infant and adult, and you can see that this one is more flat and this one is more slanted, longer, and narrower. This could also affect child hearing loss, and the people that are commonly affected are, there's 3 to 4% school age population, and 20% of low SES children develop some hearing loss, because this is due to the repeated infections that are left untreated. They can be corrected before leading to serious difficulties. Sorry about that. Before leading to serious difficulties. However, some families do not have that ability.
So, how parents should respond. Obviously, they should go to regular checkups for both their vision and their hearing, just to see if they do have an ear infection or if they are nearsighted. And for vision, there's always corrective lenses that can be used. And for hearing, you can have surgery to get tubes put in or other options.
Thank you.